This week, INOVA Health System opened its latest urgent care center in Ballston, bringing the total to 6 in Northern Virginia, and it's just the beginning. The plan is to expand to other communities. It's a healthcare trend that's catching on by healthcare providers and patients. Kathy Park joined us from the newsroom with a closer look at why this model seems to be working. Kathy?
Morris, according to patients, these clinics are more affordable compared to an ER and easily accessible. Most of the time, they can walk in and out with their medical issue addressed within an hour, and they don't even have to call ahead of time. The D.C. heat wave took its toll on out-of-towner Ian Hopkins and brought him to this urgent care center in Vienna.
I think it might be some issues with my strep, but also the humidity. And I have asthma that's been triggered by the humidity.
For this Ohio resident, the clinic was the best option around.
Urgent care is also significantly cheaper than going to the emergency room, even though I have insurance. It's about an $80 difference for me.
And with immediate availability and no insurance, Chris Gabriel also paid a visit after an unexpected encounter with bees.
So I got stung, I guess, 12 times or so.
Instead of a trip to the ER, more and more patients are turning to urgent care. According to the National Institute for Healthcare Reform, around 9,000 of these centers have popped up around the country in recent years. Just this week, INOVA opened another location in Arlington.
We felt like we can provide a service to the Ballston community without having them leave their neighborhood.
Patients can stop in 7 days a week and most holidays with or without an appointment. And both doctors and nurses are on site to treat acute medical issues.
Illnesses are like upper respiratory type infection, flu, urinary tract infection, strep throat.
And visits average about an hour.
It's much more efficient than waiting in a doctor's office.
According to INOVA, urgent care centers have helped reduce unnecessary visits to the emergency room. And then moving forward at the Ballston location, I was told the plan is to also offer orthopedic, sports medicine, OB/GYN, and behavioral health services to patients. Live